Sex hormone binding globulin, SHBG, low SHBG, symptoms, and more. Here's everything you need to know about estrogen, progesterone, androgens, progestins, synthetic estrogen, and sex hormone binding globulin, SHBG. SHBG helps to control the amount of sex hormones available to the body. This helps keep sex hormone-related processes in balance. SHBG may be related to insulin function, affecting conditions like metabolic syndrome and PCOS. Sex hormone binding globulin, SHBG, is a protein that affects the function of some sex hormones, including testosterone and estrogen, 1,2. In short, SHBG binds to specific sex hormones, removing them from direct circulation in the body, 1. In contrast, when bound to SHBG, the sex hormone is essentially inactive and has minimal, if any, biological impact on the body until it's released. In this way, SHBG acts almost as buffer, controlling the amount of sex hormones available to the body. In women and people with female reproductive organs, the vast majority of testosterone and estradiol in the blood are bound to SHBG and other proteins, and are not bioavailable. Only around 2% of these sex hormones are free to bind to receptors and make an impact on the body. SHBG can also release hormones at specific tissues and possibly into cells directly. This binding has an effect on both the sex hormones and on SHBG. Sex hormones that are bound to SHBG don't impact the function of the body until they are released, and sex hormones bound to SHBG can affect how well SHBG binds to its own receptor. Low SHBG levels, how do they impact the body? Because SHBG binds to sex hormones, its relative level can affect levels of sex hormones available to be used by the body, thus having an impact on the processes that sex hormones regulate. For example, when SHBG levels are relatively low in women, testosterone levels can become abnormally high, causing side effects like hirsutism and acne, too. There also may be a relationship between SHBG, testosterone, and libido, sex drive. Low SHBG levels are also associated with. Relatedly, people with polycystic ovary syndrome, PCOS, a disorder associated with metabolic syndrome, tend to have low levels of SHBG, 2,5,8. This might be driven by high levels of androgens, a class of hormones that includes testosterone, which both causes sex hormone imbalances and suppresses SHBG production in people with PCOS, 5. SHBG levels are also associated with weight. How do I know if my SHBG levels are normal? That being said, on average, SHBG levels fluctuate as we age. For non-pregnant cis women and people with female reproductive organs, normal SHBG levels usually fall between 18 and 144 nmol/L after puberty, 9. Studies have found that ethnicity may also impact SHBG levels. Does the menstrual cycle affect SHBG levels? Studies have found that SHBG levels may fluctuate over the course of the menstrual cycle. In one study on women with cycles lengths of 25 to 31 days, the average SHBG level peaked around ovulation and was lower during the early follicular phase and the luteal phase, 13. Guys, please, kindly subscribe to the channel, comment, share and like this video for more, or check the link in the description below. This might occur because estrogen levels affect SHBG, 9,14. Estrogen peaks just prior to ovulation, and so it's possible the increase in SHBG around ovulation is due to fluctuating estrogen levels. Cycle length may be associated with SHBG levels. In one study, SHBG levels were higher in people with cycles less than 26 days than people with cycles 27+ days, 15. How does hormonal birth control affect levels of SHBG? Hormonal birth control, like the pill, the implant, and hormonal intrauterine devices, affects levels of SHBG, depending on the birth control type. Birth control that contains estrogen, the combined pill, the contraceptive patch, and vaginal ring, increases levels of SHBG, 14,16 to 19. In these cases, the increase in SHBG is caused by the estrogen contained in these forms of birth control, 14,20. Progestin-only forms of birth control, the hormonal IUD, etonogestrel implant, the DMPA contraceptive injection, shot, and the levonorgestrel mini pill, have been shown to decrease SHBG, 21 to 25. SHBG, hormonal birth control, and blood clots. Also, SHBG levels may be an informative indicator for risk of blood clot while using hormonal birth control, 26,27. Among combined hormonal birth control users, higher SHBG levels are associated with increased risk of blood clot. This association is probably not causal, that is, SHBG doesn't cause an increased risk in blood clot. Estrogen from the combined hormonal contraceptive increases SHBG levels, 9,14, and the amount of estrogen in birth control is also thought to increase the risk of blood clots among hormonal birth control users, 28. SHBG levels appear to have an effect on breast health. For instance, in studies of premenopausal women who were not using birth control, higher SHBG levels corresponded to higher fluid levels in breasts, 29. Also, weight loss and use of some breast cancer treatments, like tamoxifen, may decrease the risk of breast cancer by increasing the levels of SHBG, 5,31,32. Also, SHBG may impact cancer growth directly, 32. Higher levels of SHBG have also been associated with better cardiovascular health and metabolic status in postmenopausal women, 33,34. Although SHBG is mostly known for its effect on sex hormones, future research may show that it has its own specific role to play in our bodies. Guys, please, kindly subscribe to the channel, comment, share and like this video for more, or check the link in the description below.